South Korea is heading into its fourth year with the COVID-19 pandemic. Currently, it's in the grip of the seventh wave of infections, which began in November last year. Although there are hints of a slowdown now. The daily case count reported on Thursday was around 64,000, about 10% lower than a week earlier. However, concerns remain over the new Omicron subvariant XBB.1.5 and the rapid spread of the virus in China. As part of our New Year in-depth analysis series, we delve into what the pandemic situation might look like in South Korea for 2023 and whether the end of the pandemic is in sight at all. And to help us with that, we have joining us via video call today, Jerome Kim, the Director General of the International Vaccine Institute. Dr. Kim, hello and welcome back to the show.
Good afternoon.
Okay, so Dr. Kim, there's quite a lot we would like to get your thoughts on today, but we have a limited amount of time, so we'll try to whistle through them as best we can. First off, can you give us your assessment of the current COVID-19 situation in South Korea? Chung Gi-seok, the nation's chief advisor on infectious diseases, expects that the current seventh wave has almost reached its peak. Would you agree with that assessment?
Yes, I think so. I think that barring the advent of a new variant of Omicron-based a new Omicron-based strain, this wave should peak in the near future.
Okay, so that's perhaps good news to hear then. But there are risks ahead, it seems. You talked about the Omicron subvariants. We'll get into that in just a second. But there is another risk that Koreans have been very concerned about. That is the situation in China. There have been an unprecedented wave of infections in the country following a drastic easing of restrictions there. South Korea has joined many other countries in tightening restrictions for people coming from China. For example, Seoul has limited issuing short-term visas for Chinese nationals until the end of January. Testing is mandatory before and after arrival. And so far, over the past week, more than 40% of imported COVID-19 cases have been from those coming from China. How concerning is that situation in China, do you think?
So at one level, I mean, and I think this is the threat to Korea, the policies that the government has taken are really, what we can do if the government wants to keep the flights going between and interactions going between Korea and China. So the testing of individuals as they arrive and shortly thereafter, I think, is really a key to the kind of control that Korea was able to use and yet maintain some degree of openness. For China itself, the biggest concern that many of us have is the fact that we don't have any information on what's going on. There have been reports that maybe 70% of the city of Shanghai has already been infected. There are reports that maybe 40% of the Chinese population have already been infected. And we would anticipate then, based on pictures and other things that we've seen, again, not official statistics, that there are significant numbers of cases in hospitals, that there is probably a significant there's a significant crowding of intensive care units, and there have been reports of significant deaths. But if you look at the official figures yesterday, China reported 5 deaths from COVID. This is on one of the websites that reports deaths from countries all over the world. And that's concerning because we don't know the full extent of the pandemic in China, whether new variants are emerging, although based on the data that have come out from last week, it looks like pretty much they're seeing what other people have seen. And there are many sort of local outbreaks of significant concern, but local outbreaks in China with variants that we've seen before. But there's always a risk that out of this, significant increase in the number of infections, there could arise another variant. And will we be able to see it? Will China notify other countries in the region or other countries in the world, the WHO, about this new strain? And then the final part is, the level of human suffering. I think Korea has been through this. There was a time earlier in 2022 when there were 800,000 cases a day. And, the intensive care units did fill up. And there was an increase in the number of deaths. although again, Korea has done relatively well compared to other countries. When you look at the number of deaths last year, it was substantially greater than the year before. So again, I think we understand that there is going to be suffering in China as China opens up. Many countries have been through it, but right now the world doesn't have any further information on the extent of the number of infections or the number of hospitalizations or the number of deaths.
Yes, of course, it's very concerning for the people in China. But the concern of a variant is our biggest concern for those outside of China, right? For those in South Korea and the rest of the world, you mean?
Yes, and it's true that variants generate outbreaks and outbreaks generate variants. And XBB is a combination of two forms of one of the Omicron subvariants called BA2. Could this be happening in China? Yes. Is it likely to be happening? Yes. Will they cause outbreaks that further complicate the situation in China and globally? We don't know. And so having information is really one of our most powerful tools. So openness and sharing of information is really critical in our ability as a global community to manage the outbreak.
So new variants are of concern. A more immediate variant of concern right now is the one you mentioned, XBB. It's been spreading rapidly in the US, and it has also been detected in South Korea. It was detected for the first time early December last year, so just about a month ago. Experts have said that this subvariant could be more infectious and immune evasive. What do we know so far, and how much of a risk do you think it poses?
So XBB has gone from 20% to 40% in the United States. And if you think about what the United States has been through, they vaccinated maybe 60 to 70% of their population. They've boosted maybe 40% of the population. And a significant proportion of the rest of the population has been infected. Yet XBB is spreading. So we know that this variant, because of the mutations that are in it, is much more readily spread than even older forms of Omicron, which were much more readily spread than the other variants of concern. So there is a possibility, again, that XBB could spread in Korea. And what will that mean? An increase in the number of infections means inevitably an increase in the number of hospitalizations and an increase in the number of deaths. Now, because of the level of vaccination in Korea and boosting and prior infection, we don't anticipate seeing a lot of deaths. But if you have enough infections, even a 0.02% case fatality rate results in deaths. So again, this is something that we have to remind ourselves that yes, the virus is spreading more quickly. That means more people get infected, and even if the mortality rate is very low, people are going to die. So again, I think the key messages here are boosting, the first one. And then for the government to carefully monitor what information it has, because as it's thinking about potentially loosening up on, for instance, indoor masking, they're going to need criteria, which they appear to have, that they will use to guide their judgment around the question of whether masks are still required.
On that issue of masks, that is another issue that South Korea is discussing and debating when to scrap the indoor mask mandate that still exists here in South Korea. Health authorities have recently announced plans to scrap it in phases. The first phase lifting it for most indoor facilities, except in high-risk locations such as in healthcare facilities, pharmacies, social welfare centres and public transport, of course. The second phase would be to lift all restrictions. So that would be decided taking into consideration various criteria, of course, such as daily infection rates, the deaths, patients in critical care, and healthcare capacity, and so on. What do you make of this phase-out plan? Do you think the country is ready for mask-free indoors as well soon?
So, we have been seeing a fairly high rate of infections anyway, even with indoor masking. And the reason, of course, is that it's really transmission is occurring in settings where we aren't wearing masks routinely. So in our private settings at home, in restaurants, when we're out with friends eating or drinking. So again, I think this is one of those things where the government will have to have criteria, um, and I think the Korean government has been very good about setting criteria and following the data in order to make policy recommendations. And I think that's the best that you can do. Having traveled now in Africa and Europe primarily over the past several months, very few places are continuing to use masks indoors. And coming from Korea and being used to using masks, it feels a little uncomfortable. But after a few days, you get used to not wearing a mask.
Hmm.
Um, and it's actually at that point where you're probably the most vulnerable because now you're confident. And so again, I think it really should be based on data. It should be based on the circulating viral strains and whether they're causing, associated with more severe outcomes, that is, more severe outcomes in terms of hospitalizations and deaths. And then, what they're seeing in terms of the capacity of the healthcare system to absorb a significant increase.
Is there a concern still, though, that once we ease those restrictions, once we lift all indoor mask mandates, that there will be a rise in cases?
There's a possibility. And, it's hard to use data from other countries because many of those countries aren't testing as much anymore either. So although people are getting infected, the countries are not really doing appropriate testing. So they don't know and they don't isolate, which actually contributes to even more infections. So I think, again, when you're thinking about the spread of COVID and the impact on a society, really you're looking at, are we preventing the most severe outcomes? Are we protecting the populations at greatest risk? The elderly, people with immune compromise uh, immune compromise or
Hmm.
diseases that decrease your ability to respond to infectious disease threats. Do we have appropriate levels of boosting in the community? So has everyone who can get the new bivalent vaccine, the mRNA vaccines, have they actually gotten them? So again, the government will need to look at these things because what we had before, the monoclonal antibodies don't work as well. In the elderly, maybe some of the antiviral medications can't be used because the elderly are on other medicines that may contraindicate the use of the antivirals. So all of these are things that we need to look at as the government needs to look at as they think about trying to remove the indoor mask requirement.
Okay, so looking ahead to the rest of this year then for South Korea, what do you think people can expect? Are we nearing an end to this pandemic, or is it just too early to say, considering all the risks that we mentioned already?
Yeah, that's actually a great question. I think the easiest way to think about this is, the pandemic had phases also. We are exiting the emergency phase, but we haven't exited the pandemic. And the way I think about it is, in 2021, a bit over 4,000 Koreans died of COVID. Last year it was 26,000. By comparison, an endemic disease like influenza in general kills between 2,000 and 5,000 Koreans a year. So if you're really thinking about COVID at this point, it's hard to say that we've entered the endemic phase, that the pandemic is over.
Hmm.
So we've exited the worst phase, but we're still in the phase of having to deal with it. And I think it's an even better case in the United States. Last year, COVID killed 270,000 Americans. By comparison, influenza kills between 20 and 50,000. Influenza is endemic. COVID at killing 270,000 people is not endemic. So again, I think we need to look beyond just the simple numbers of infections and the fact that people don't get as sick at the number of deaths that COVID is causing. And have we done everything possible to minimize the impact of COVID on society? So I think this year may be a year of removing restrictions, the indoor mask requirement. But at the same time, the government is going to be vigilant. I think that's the way the Korean government has reacted to this in the past, and watch the numbers, because those will give us an indication of what we can expect in terms of new circulating variants and the impact of those variants on society and on the economy.
So there was one German virologist, Dr. Christian Drosten, who has said that they believe that the pandemic has ended and that COVID-19 is now in an endemic phase. And in fact, he added that the virus stands little chance of surviving by the summer because the immunity in the German population will be so broad and resilient after winter. What do you make of that analysis?
So again, I think when I think about an endemic disease, it isn't a disease that kills 270,000 people in the United States, or 26,000 people in Korea. As we go through the year, as more people are boosted, as we are watching the emergence of new variants, maybe we can really say that we're exiting the worst phase of the pandemic and are entering the endemic phase. But right now, at the peak of the seventh wave, with a potentially even more transmissible variant in the offing, waiting outside and growing in Korea, I think it might be premature to say that we've exited the pandemic phase.
Right, so it seems we can't turn the page on this chapter of history yet, and we just need to remain vigilant and cautious for now, and then hope for better down the road, you're saying. Okay, well, Dr. Kim, on that note, we'll leave it there. We've been speaking to Jerome Kim, the Director General of the International Vaccine Institute. Dr. Kim, thank you for your time and your thoughts today.
Thank you.